can affect basement membrane. So now we know about the glomerulus. Let's learn about renin-angiotensin aldosterone system. So we have glomerulus, afferent arteriole, efferent arteriole. We have Bowman capsule, proximal convoluted tubule, loop of Henle, distal convoluted tubule, collecting duct. So I will say afferent arteriole. Afferent arteriole is surrounded by JG cells, and they secrete renin if blood pressure is low. So this renin will actually go into the blood, and in the liver can produce a protein called angiotensinogen. Renin will convert angiotensinogen to angiotensin 1, and then angiotensin 1 will go to the lung, where there is an enzyme called, lung can produce an enzyme called ACE, angiotensin converting enzyme, which will convert angiotensin 1 to angiotensin 2. And this angiotensin 2 has multiple function. Let's discuss one by one. So angiotensin 2, first it can constrict vessel. It can cause vasoconstriction of the vessel. Second, it can also constrict, because it's causing vasoconstriction, it will also constrict efferent arteriole, which is this artery coming out of the glomerulus, efferent arteriole. So when you constrict this vessel, the pressure, there will be a back pressure increase in the glomerulus. The back pressure will increase in the glomerulus because you are constricting the outflow of glomerulus. So that will result in increased filtration fraction. So if we stay in the kidney, it will act on the kidney, and it will cause increased reabsorption of sodium and water by increasing the activity of sodium hydrogen ATPase. It will act on aldosterone on adrenal gland, increase aldosterone level, which will increase reabsorption of water. So reabsorption of sodium, excretion with water, excretion of potassium and hydrogen in collecting tubule. The last function is it will act on ADH. So basically it acts on hypothalamus, increase thirst, and hypothalamus can produce ADH. ADH will increase water reabsorption. So these are the multiple function of angiotensin 2. So this is how it maintains blood pressure, by constricting the vessel, constricting the efferent arteriole, by reabsorbing more sodium, by producing aldosterone through adrenal gland, by increasing thirst via ADH. Okay. So function of the aldosterone we already discussed: vasoconstriction, release of aldosterone, ADH, increased thirst. What is mean by contraction alkalosis? This is an important term. You will see there's a question trying to understand. Uh, efferent arteriole, sorry. So this is EA is efferent arteriole. I just kind of use the term. So it constrict efferent arteriole, which is arising out of glomerulus. So if you constrict the efferent arteriole, the filtration fraction, the back pressure in the glomerulus will go high, and then the filtration fraction will increase. Sorry. What is contraction alkalosis? So whenever there is low blood pressure, aldosterone level will go up. We know that now. Increase aldosterone. So low blood pressure is basically, you can also call it contraction. Contraction. Increased aldosterone will cause reabsorption of sodium along with water, and it can cause excretion of potassium and hydrogen. So when the hydrogen is lost from the kidney, that will cause alkalosis. That's why you can also call it contraction alkalosis, which happens with low blood pressure. So let's say if someone is taking Lasix or any diuretic and you check their blood work, if their bicarb is high, this is because of contraction alkalosis caused by Lasix, or it can happen because of dehydration. So any state of dehydration can lead to contraction alkalosis. Now, what are the endocrine function of the kidney? Renin, angiotensin, aldosterone system, we already discussed. We know that. Proximal tubule converts vitamin D to its active form through 1-alpha hydroxylase. So proximal convoluted tubule, they have an enzyme called 1-alpha hydroxylase, which converts 25 hydroxy vitamin D, which is a storage form of vitamin, to its active form 125 hydroxy vitamin D. Erythropoietin. How erythropoietin is released? In response to hypoxia by interstitial cell in peritubular capillaries. So what they are talking about? So we have glomerulus, efferent arteriole, and then glomerulus is surrounded by Bowman capsule, proximal convoluted tubule, loop of Henle, distal convoluted tubule, collecting duct. This efferent arteriole, which is arising from the glomerulus, divide into peritubular capillaries. So whenever there is a hypoxia, the interstitial cell in peritubular capillaries, they can produce an enzyme with a hormone called erythropoietin. Prostaglandin. This is a parakine secretion which vasodilate afferent arteriole to increase renal blood flow. So prostaglandin can dilate afferent arteriole. Okay, what kind of question they can ask you in the exam? They can actually give you this image, glomerulus, afferent arteriole. They can just give you this image and this Bowman capsule. And you need to know what are the drugs or what are the medication which can dilate or constrict afferent or efferent arteriole. So if someone is taking NSAID, NSAID will decrease prostaglandin, and function of the prostaglandin is to dilate afferent arteriole. If prostaglandin is not there anymore because of NSAID use, then afferent arteriole will be constricted because of NSAID. Because NSAID inhibit prostaglandin, and function of the prostaglandin is to vasodilate afferent arteriole. What can constrict efferent arteriole? We already discussed angiotensin 2 can constrict efferent arteriole. So there is another hormone which can be produced in the kidney. It's called dopamine. It is secreted by proximal convoluted tubule, and it promotes natriuresis. It can excrete sodium. At low dose, it acts as vasodilator, but at high dose, it acts as vasoconstrictor. And it affects both afferent and efferent arteriole. At low dose, it can dilate both afferent and efferent arteriole, but at high dose, it acts as vasoconstrictor. So this is renin-angiotensin, aldosterone system, and other functions of the kidney.